The body produces abnormal bone to compensate for the loss of cartilage. And this can happen in any joint, hip, knee, shoulder, but often can also affect the hands. In hand osteoarthritis, the typical joints that are affected are the furthest joints away, so the distal ones, the ones that are furthest up on the finger. The other area is the base of the thumb, so at the bottom of the thumb. Hello, my name is Dr. Ziad Farah. I'm a consultant rheumatologist and general internal physician. Today I'm going to talk to you about hand osteoarthritis. So what is hand osteoarthritis? Well, essentially it's osteoarthritis affecting the hands. Osteoarthritis is a condition where there is loss of cartilage, which is the smooth surface of the joints, and that leads to the joints moving in a not smooth pattern. It's a bit rough, and the body produces abnormal bone to compensate for the loss of cartilage. And this can happen in any joint, hip, knee, shoulder, but often can also affect the hands. In hand osteoarthritis, the typical joints that are affected are the furthest joints away, so the distal ones, the ones that are furthest up on the finger. The other area is the base of the thumb, so at the bottom of the thumb. Now, these areas can present in many different ways. One of the most common is deformity. Patients often mention that they've developed some bony nodules on the affected joints. They also notice that the thumb is looking abnormal, it's changing position, it's no longer in a smooth way, and there's a corner or an edge, for example. These are all signs of osteoarthritis affecting those areas. Pain is a common symptom, stiffness is another. Sometimes patients feel clicking sensations in their hands. So how do we diagnose osteoarthritis of the hands? Well, the history is important. It's often a gradual onset of pain affecting those areas. Examination will often find the features I've mentioned, whether it's bony nodules on the fingers, so these are hard nodules as opposed to soft, or deformity, for example, at the base of the thumb. To follow with that, imaging is really important here. X-rays will show characteristic features of osteoarthritis, or ultrasound will also show other features. It's important that I exclude other diagnoses like inflammatory arthritis. That's where there's inflammation of the joints caused by the immune system, a completely different diagnosis with a very different set of treatments. Now, how do we manage hand osteoarthritis? Well, there are many things that can influence the development of hand osteoarthritis. Patients at risk are those who are overweight. Women, around the menopause in particular, are at risk of hand osteoarthritis. So these are things relating to hormone levels, genetics, all those features. These are things that we can't modify very much, but certainly adjusting weight, for example, weight loss can improve even hand osteoarthritis. The other is to address the symptoms, whether it's with anti-inflammatories, these could be oral or topical, like ibuprofen gel. The third is with physical interventions, whether it's with hand therapy to help improve mobility. Sometimes splinting can be helpful. Rarely a steroid injection can be needed, and I don't advocate this on a routine basis, because too many steroid injections can sometimes accelerate osteoarthritis to form in that area. And in the extreme cases where, for example, a patient complains that they can't use their hand at all, or the pain is so significant it's impacting their life, I tend to refer them on to orthopedic colleagues to consider surgical options to treat it. Now, we don't really understand osteoarthritis very well, and there's a lot of research going into it. The research is going into things like what causes it, whether it's the hormonal factors or genetic factors. How can we improve it in terms of treatments, whether it's tablets or pain modulation? And that last area that's being looked at is also surgical interventions. How can we do surgery to help improve outcomes overall? But early diagnosis is also key. It can help patients prognosticate. It can help also plan for the future, especially, for example, needing adjustments to equipment to help use the hands despite the deformity that it can form.